Hi everyone, and welcome to our first lecture in HAN for 2022. The purpose of this lecture will be to provide you some orientation during the first few slides about the subject itself, the content it's covering, the classes, and other related information. And then in the second half of this lecture, we will be going through some of the topics that have been made available to you in the form of video clips that have been opened to you over the last week. So we would assume that prior to this lecture, you have went through the video clips, series of the video clips available for this week. And then we've got this interactive lecture, just contain some questions just to help us better understand the topics. If you've got any question, feel free to jump in and ask your question if you like. And also, yes, yeah, thank you. Okay, let's start with that. So feel free to ask your question either during the unmute and talk or post it on the chat. I'll be monitoring it as we go through the class. All right, so let's start with this one. Sorry, I should introduce myself at the beginning. So my name is Haidar Al-Ubaidi. So I am one of the anatomy teaching staff here at La Trobe University. This is all my contact details, and this is my office location if you would like to come and have a chat with me in person. For email communication, please use the subject's email when you submit your inquiry, if it is about something related to HAN. The idea of using the subject's email rather than my personal email is because if I am on leave, there will be another staff within the coordination team who's monitoring the email and can communicate back to you. And also because I am doing more than one leadership role, I'm receiving an average of 50 to 60 emails per day. So, but the priority will be for the course I coordinate and for the subjects I coordinate. That's why if you submit your email directly into that one, we make sure that we respond to you ASAP, because if I'm not there, one of the coordination team will be available. Okay, so the weekly structure for HAN timetable, there will be 3 classes available each week. The first one is on Monday, which includes this lecture, and you can access it using the same link in same Zoom link every Monday at 10 o'clock. The way that we deliver the lectures for this year, there will be 2 main types of lectures. If we are covering the contents that have been already made available to you via the video clips in the previous week, similar to today, where you already have access into the contents about the skull and meninges, TMJ as well. So the lecture will be in the form of interactive, which contains series of questions, and you can work with us to provide some answer. And this is just a way to help you better understand the topic. However, if we are discussing a new topic, which have not been covered in the video clips, then there will be, this lecture will be considered as a classical lecture where we cover a new topic and we'll go through it similar to the classic lecture format. On Wednesdays, there will be tutorial workshop, and the tutorial workshop will help us to prepare for the Friday tutorial class, which help us prepare for the Friday workshop. So in the tutorial, I will be posting a set of questions as well, set of questions prior the day before that we can discuss during the tutorial to prepare us to the practical workshops on Fridays. These subjects this year we have blended and online mode. Both students in both modes will be having the same contents here, Mondays and Wednesdays classes. But the difference, the main difference is in Friday, because the blended mode will be doing the face-to-face practical workshops, while the online mode, they will have their Zoom workshop, similar to what you have used to do in Tal and Lynn last year when we did these subjects purely online. During the first class, whether blended or online on Friday, the relevant demonstrators will provide you with some information related to these classes. The text and the required resources for this subjects have been listed for you here. So in addition to the textbooks, the clinically oriented anatomy and the clinical neuroanatomy, we will also be relying on the student's manual. And student's manual is available to you in the Start Here section, the first section in HAN. So when you log into the main LMS, you will find a quick introduction video that I've recorded last week and made it available just to help you better orient into the contents, okay? If I try to show you this from my end, and also remember to do the anatomy lab quiz. So if I try to show you the LMS page, just see where it is located. This is the one. If I go here, I put it into students mode, so it will be exactly similar to your view. So you can watch this video. If you know the details, that's fine. You don't need to redo it again. Staff posting, this is where we will be posting important information on weekly basis or related to the subject. You can post any general question you've got here through this link. And if you look here, I can see week 1, week 2, week 3 contents. If you can't see these 3 sections, what you need is to watch this video and complete the anatomy lab induction quiz. You need to do this quiz first to enable you to view the contents of the first 3 weeks. So it will be something similar to my view. The first thing you would like to do after completing the anatomy lab induction quiz is to go into Start Here and familiarize yourself with the content. So this year, because to make life easier, especially when having a dedicated online instance, I've grouped a set of questions, common questions that students used to ask us before about the contents, about the assessment, about my career module. I put the answers for them in this PDF. This is a dynamic version of the file that I updated on a weekly basis. Based if there is, if I receive new questions from you, which is still important, need to be included there, I'll make sure to include it here. So that if you've got any question related to HAN, your first station of contact will be this PDF file. I'll try to open it here if I see it's working. Because this will provide you a quick answer into the contents, whether the subject's availability in terms of classes, which class will be recorded or not, the assessment, some details about alignments with the requirements of the assessment. And the last one is about, last page is about my career module. So if you haven't done so, I would encourage you to download a copy and keep it in your record and have a look on it. If you've got any question before contacting the subject coordination team, because it may provide you with the answer directly. Subject learning guide, thank you, Mia, for letting me know. I've just updated it earlier. Just the dates all correct in the previous version from last week, but it was reflecting 2021. I amended into 2022 year. Timetable, and this should provide you with the better information about the classes, which when you've got your own class and in which area, or if it is face-to-face where you need to go, and who's the staff will delivering this class for you. Students manual, this is the one that you need to download for Friday's workshop. So it has series of practical workshops that we'll need to go through it on weekly basis. And this will be the same for both online and face-to-face. However, the approach will be different inside the class. In addition, there will be a set of other resources like LTU Insight, which will rely heavily on it, while in the subjects, there will be other resources that will provide you with additional information. So please familiarize yourself with the contents here and start here before going through the rest. For the online classes, there will be the same link. You will need to click on the same link every Monday. The same thing for tutorial class. For the online instance, you have these Zoom links for your related online workshops. For the blended students in the blended mode, obviously you don't need to worry about that because you'll be coming in person. For assessment section, here you've got some details about the assessments and the due dates for the assessment. I've tried to reflect more information about this in the frequently asked questions PDF, as well as in the assessment section of the student's manual. If you scroll more further down, you can see much more details about each assessment items, due dates, some or further information related to that. So hopefully this should provide you with a quick access and quick orientation about the subject's contents. Let's resume the class. Right, put that one here. Okay, beautiful. So moving to the next, just reopen the tutorial. Yes, Suna. So once we record the class, like on Monday or on Wednesday, the recorded video will be uploaded in the relevant week. Like, for example, today's lecture is related to week 1. Okay, so after the class, when I've got the link ready for the recorded lecture 1, I'll be putting the link for this lecture in week 1 content. And this will be much easier for you when you do revision, because if you go into week 1 content, you can see everything, all the related links and the resources in that week, rather than moving or navigating between multiple sections just to retrieve the relevant information for week 1. So hopefully this, students who previously found it really useful, and hopefully you will find it the same. This is the timetable as we explained. For assessment in this year, we have 2 flag tests, 1 team report, 1 My Career module, and 1 end of semester exam. Further details available as I show you in the assessment section. Special consideration, as you are quite familiar with this from your previous study. Last year and the year before. So if you can't attend a specific assessment and it weighs more 15% or above, you certainly need to formally submit a special consideration application form. But if the weight of that particular assessment is below 15%, then please get in touch with the relevant subjects coordinator directly. Even if you are submitting an application for special consideration, make sure to let the relevant subjects coordinator know, so that they expect an application, a formal application submitted by you from the special consideration team. There have been each year we take the students' feedback on the subjects and on the teaching in consideration. So this is just a quick start from the students' performance from 2021 version. You can see here that the average pass mark was 70% and success rate was 92%. Additional more details if you'd like to look into the stats in details. And here we've got also some details about the response between 2020 and 2021. This year we'll do something similar. So I'll ask you for your feedback, look for the response, and look for some of qualitative response. The qualitative response will be used here to help us better develop the subjects for next year. So you can see here there is no week 0 contents have been implemented in this year. but we made week 1 contents available a week before to the students. This year I've just put all the head and neck anatomy available, like week 1, week 2, and week 3. All the contents made it available. You don't need to read, go through week 3 now, but some students prefer to have a few weeks available for them for like family or work related duties. So I'll try my best to make contents available to you. If not 1 week, it will be certainly more than a week prior, so that you've got plenty of time to go through this. We readjusted the assessment for this year, so we have only 2 flag tests, but we're offering a team report. You are very welcome to go through the rest of the details here, just to have an idea about what changes or what amendment we have included here based on students' feedback from last year. Okay, do you have any question related to the subjects, orientation, assessment, anything before we start with the interactive content for week 1?
Yeah, the flag test will be half an hour or 15 minutes?
So the flag test, there will be, if I take you to where is that? So yeah, that one. So if you go into the assessment, okay, section, and scroll down into flag test section, this is for flag test 1 and 2. It's telling you some information here, how many questions. There will be 7 MCQs, blah, 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 where you will be sitting there. And you can see you will have 28 minutes from when you start. Please consider blah, 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 blah. So hopefully this should provide you with some information related to number of questions in the flag test, its weight, the duration of the flag test, when you will be need to access the flag test here. So hopefully this should provide you with some answer. Is that okay?
Yes. And is attendance is compulsory for Monday and Wednesday classes or lab also?
Sorry, can you repeat your question?
Is attendance like we need to attend the Monday, Wednesday in case emergency, like we have to attend, like attendance will be count? Okay.
So this year, the advice that we received from the, I'll just go back into that. So the advice that we received from the school is that we don't enforce attendance. If you can attend, that would be fantastic, obviously, because our previous study have showed that students who attended classes tend to perform really well in the assessment. If you cannot attend, that's fine. The Monday and Wednesday classes will be recorded and uploaded in the relevant weeks. For the Friday workshop, because it's a team-based work, we won't be able to record these sessions. If you cannot attend the Friday workshop for any reason, please make sure to go through the questions and answer them. Have a chat with your peer students who attended this workshop. If you still are not able to answer any of these questions, feel free to get in touch with myself and the coordination team. Also, this year, we are offering Science Hub, frequent Science Hub sessions. So there will be anatomy tutors available online to answer questions related to anatomy subjects in semester 1. I'll be posting their Zoom sessions on staff post later today.
Thank you.
What else we've got? Are we able to change it to blended mode now, or is it too late? Yes. I can't see your name. It's ending your student's number 5547. If you are enrolled in one instance, but you wish to move or switch to the other instance, what you need is to go back into students online, withdraw from this instance and enroll in the other instance that you want. I would strongly suggest that you do it today. Don't delay it later on, because we have already developed the practical workshops and we'll start with the preparation for the Friday workshop. So if you are planning to switch your instance, please make sure to do it ASAP. Any other question? It will be much easier if I know your names. And so to change your name, right-click on your name and change it from the email with your name, with the name that you prefer to be called. So this the answer here for students 9967 is the image used in the exam and the flag test from the manual only or the lecture 2. The flag test will include or may cover resources covered in the lecture, tutorials, or practical workshops. So we may use image from any of these resources. To help everyone to be on the same page, what we do usually, so if you go into, I'll get back into that subject. So if you go into week 1 as an example, what I tend to do is to create, this is week 1 content. If you scroll down to where we've got workshops, you can see here we've got practical 1 and 2 image banks. So here we've got a list of the common image bank that we may use, whether in the tutorial or in the practical workshops. If you go into the face-to-face classes, you will see image of these like models. We have image of the Auckland resource that is available for you and start here. So I would suggest that you look into this image and familiarize yourself with them. Yes, Hannah. So I will be showing you, it's already ready, but I don't want it to display it right now because the team report in week 12. So prior to week 12, like few weeks prior to week 12, I will make it visible, a self-allocate team report sheet. So you can choose, become a member in a specific group with your teammates. So you can have a chat with your team mates in the same who are doing sorry, who are doing the same workshop. Make an agreement between you, a maximum of 5 students per each group. And when the self-allocate sign-up sheet is ready, I will post it, like a post a notification, and then you can sign up there. Okay, so let's get back into this, and we'll start with the classes for today's workshop. All right, so here from the skull links, so we've got these images that have been covered by the video clips about the skull. So here you can see that the skull can be split embryologically into 2 components. We've got this components on the top, which houses the brain and brainstem. An idea what we call this one?
Neurocranium.
Thank you, neurocranium. And then the second part here, which forming part of the facial skeleton and also covering the visceral structure within the head. Hence, it's called
Viscerocranium.
Fantastic, beautiful, viscerocranium. So here we've got a set of bones within forming the neurocranium and another set of bones forming the viscerocranium. There is one common bone in between, and we have a good discussion about this last week in week 1 content. So here we've got ones of the viscerocranium. We have labeled some of them, and we need to work on the rest. So for this color, which is this one here, forming part of the nose, hence its name is, what we call this one?
Nasal bones.
Nasal bones, thank you. So nasal bones, and we can, if you look here, we've got 2 bones, right and left, hence we've got, it should be nasal bones, excellent. While for this color, which is this one, on the side, on the cheek side, so what we call this one?
Zygomatic.
Excellent, so this is zygomatic bone. And for the other one, which is this one here, so it's forming part of the roof of the oral cavity.
Palatine.
Sorry?
Palatine.
Yes, excellent, beautiful palatine bone. So here you've got set of the bones that forming the visceral cranium. You can see the ethmoid here, which we can see in yellow color. So it's forming a part of the facial skeleton as well within the nasal cavity. So this is the ethmoid. If you look into the neurocranium, which houses the brain, we've got also some of them have been already labeled. Let's look into the others. This color, which is this one here. You can see it in this one as well. So any idea which one is this one?
Sphenoid.
Sphenoid bone, fantastic. This is one of the complicated complex shape bone, which is like a spaceship, which has wings on the central body. How about this one here? I think it's this one, yeah. So what we call this bone?
Temporal.
Temporal, excellent. And for the yellowish part that we have identified in the previous slide is? Sorry?
The ethmoid.
Ethmoid, excellent, the ethmoid bone. Hence, the ethmoid is the common bones between both neurocranium and visceral cranium. I'm a bit reluctant to go into the details about this because of the sake of the time in the lecture now, but we certainly will have more time to go through some of the details about, like, for example, ethmoid, what we call this part of the ethmoid here as compares to its name in or the part of the ethmoid here. So we'll go through details about this later on in the Friday's workshop. We can also discuss some of these on Wednesday tutorial as well, just depending about the time there. Going into the joints of the skull, so we've got different types of the joints in the skull. The common one is this one, which communicate the flat bones. So what we call this joints that connect the flat bones of the calvaria.
Suture.
Sutures, beautiful. And if you look into this joint here, that forms the like insertion of the teeth. So this has also a specific name, which is called
Omphosis.
fantastic kymphosis. Thanks, Mohammed, and for the lady who provided the answer, because I can't see the person's talking, but it's kymphosis. Excellent. What else? The other types of the joints that we've covered in the video clips is this one, which is called temporomandibular joint. Okay, and this is the joint that communicate the mandible with the skull. And this joint here that communicate the atlas with the occipital bone. This is called atlanto-occipital joint. Both of them are type of synovial. So hopefully in the previous the previous 2 years of studying anatomy, you know how to differentiate synovial from fibrous and cartilaginous. And you also learned the different types, functional classification of synovial joints. Okay, so if this is a synovial joint, we need, I mean, structural wise, it's a synovial joint. We need to look into its functional classification. Any idea about the functional classification of the temporomandibular synovial joint?
Modified hinge.
Modified hinge joint.
Excellent. It's modified hinge joint. Beautiful. How about the atlanto-occipital joint? What's functional classification it has?
Ellipsoid.
Ellipsoid or condylar joints. Fantastic, guys. Excellent. Make my life much easier moving quickly. Communications. There is, or there are other sets of video clips related to the communication because the skull forms like a closed bone, and we've got the brains inside. It needs to communicate with the rest part of the body through specific dedicated foramina. Okay. So if we look into this foramen here, so sorry, some orientation here, we've removed the top or the thin part of the skull, and we are looking into the skull now from the superior into the inferior side, okay, by removing the brain. So we are looking into these two openings. Any idea what we call these openings?
The optic canal.
Optic canal, fantastic. So just a quick orientation here. The cranial fossae, we have 3 cranial fossae: the anterior cranial fossa, the middle cranial fossa, and then the posterior cranial fossa. So the optic canal, you can see it's starting or begins from the middle cranial fossa. So here we've got the optic canal, and its location through this bone. You remember the spaceship that we identified in the neurocranium? So its location should be which bone here? Ethmoid, good attempts. The ethmoid should be slightly anterior, where we've got this yellowish sieve of yellow bone with holes. But if you move a little bit posterior here, within the middle cranial fossa, we've got a spaceship that has multiple compartments. Sphenoid. Yes, excellent. So we've got the sphenoid. And in the workshop, in the practical workshop, we will learn different parts of the sphenoid: greater wing, lesser wing, and ciliatorsica, and so on. And the communication, when we talk about the communication, we need to connect the 2 spaces that this canal connects. So because the optic canal started from here, from the middle cranial fossa, so it communicates the middle cranial fossa to what? It's optic canal. So it permits passage of, from its name, optic nerve. Optic is for vision. So it should communicate the middle cranial fossa to the orbit anteriorly. Okay? So it would be good to know the foramen, which structure pass, and if we know which structure pass, function of that structure, it will be easier for us to know the communication, the spaces that it communicates. In the tutorial class for week 1, I'll show you a simple diagram of the skull with a set of foramina that we will go through them and identify the structure that passes through. So stay tuned. This is one of the important topics for skull contents. Okay, how about this foramen here?
Jugular.
Jugular foramen. Okay, so this is the jugular foramen. Any idea about the fossa here, what we call this fossa?
Posterior cranial fossa.
Fantastic, posterior cranial fossa. Okay, if we look into the bones here, we've got 2 bones. This bone, which forms the border between middle and posterior cranial fossa, and this one here at the back. So what we call this bone here?
The temporal bone.
Temporal bone, beautiful. And the bone at the back is called, so this is the temporal bone. What we call the bone at the back here, that's forming most of the posterior cranial fossa.
Occipital.
Occipital bone, beautiful. Okay, so clear all that. I'll move this, and the location here should be between the petrous part of the temporal bone. So the temporal bone, because it has different components, like the we'll cover this later. I'm just a bit reluctant to go into the details of the petrous parts of the temporal bone and the occipital bone posteriorly. So this is where it's located. So if we talk about the communication, we need to mention the posterior cranial fossa communicated with what?
Foramen magnus.
Foramen magnus, good attempt. So this is the foramina magnus, which is slightly away from that. This opening, it's on the lateral side. So it connects this one, this foramina or this fossa, posterior, to something beneath it, inferior to it.
Neck.
Neck, beautiful. So it's connecting the posterior cranial fossa and the neck. Any idea what structure passes through it?
Jugular vein.
Sorry, can you repeat?
Jugular vein.
Jugular vein, fantastic, jugular vein. From its, hence you should appreciate the name of jugular foramen. Okay, and we'll talk about this shortly. Okay, how about this one, this foramen here?
foramen ovale,
foramen ovale. Thank you, foramen ovale. And its location should be in what?
So the greater wing of the sphenoid bone.
Ah, fantastic. To the point. Greater wing of sphenoid bone. And hence it should communicate this fossa, which is called what?
The middle cranial fossa.
With a beautiful middle cranial fossa with what?
The infratemporal fossa.
Infratemporal fossa. And this is one of the challenging fossa that some students may find it a bit difficult to understand. We can certainly go and identify the important fossae during the workshop, whether online or blended. So it won't make a huge difference. If you are doing online, we've got expert demonstrators to show you these fossae and in three-dimensional orientation. So stay tuned with us. Before we go on to the next slide, any idea which structure passes through this one?
Is it the mandibular division of the trigeminal nerve?
Oh, fantastic. Beautiful. So we'll discuss later on the three divisions of the trigeminal nerves, and we can see which, or we'll learn which division passes through which foramen. Again, we'll practice this in details during the tutorial workshop this Wednesday. Okay. So far, so good. Any question before we move to the next topic? As you can see that because we've already covered the contents in the video clips for that week, we just select a couple of important things, put it here, and we'll go through this in this form of question and answer. This is how we usually run the interactive lectures. Some staff may prefer to prepare like a set of clinical scenarios, and this will be much more relevant as we move towards the neuroanatomy and the organ of special sense. So there won't be like a fixed way of delivering the interactive class, but there will be some flexibility. The idea is you review the contents in advance before coming into the lecture, and then you can see and look into the slide for that interactive lecture. Try to make an answer or attempt some of the questions there, so it's much easier for us to run the show on that day. Okay, so if we go into the meninges, we've got 3 layers of meninges. Can anyone list them?
Dura mater.
Dura mater, yes, one.
The arachnoid,
Arachnoid, second, and
the pia.
pia mater. Beautiful. Which one is the most tough layer?
Duramen.
Dura, which is the most outermost one. It's the tough layer, while the thinnest one is the innermost layer, which is the pia mater. If you look into the white specimen, it's very difficult to differentiate between the pia mater, which is a very thin, and the brain tissue, okay? Unless you use microscope to look into the specific tissue level. But macroscopically, macroscopically, it's very difficult to peel off the pia mater easily from the brain tissue. But for the arachnoid is the middle one, and the blood vessels here, we call them cerebral blood vessels, whether vein or arteries. They pass in the space which is called subarachnoid space. So this is the space between arachnoid and pia mater. Okay, and we've got more information to talk about this in the upcoming week. Next week, we'll also discuss this further details. So this is a very simple schematic diagram from the student's manual. Here we've got a vertical section, okay, that passing through the brain and the cervical region or the neck. When we look into the vertical section, it's either coronal or sagittal. Any idea about this section? What do you think?
All right.
Coronal.
Coronal section, beautiful. Coronal section, which passes through that region and split into anterior and posterior compartment. So here we've like made a coronal section, and we are looking into the internal contents. So as we would expect, the brain, which consists of several components like cerebrum, cerebellum. So the cerebrum should be locating or forming most of the brain parts here. We'll talk more about this in the upcoming weeks when we cover the neuroanatomy stuff. While inferiorly here, we should have what?
The cerebellum.
Cerebellum space, beautiful. So we've got the cerebellum here, while the cerebral hemispheres can be found superiorly. You can say cerebellar hemisphere, so it fits with the cerebral hemisphere, okay? So shouldn't be a problem. And if you look into the pia mater, it's the innermost part of the meninges, which covering the surface of the brain, okay? In addition, you can see the middle layer is arachnoid, which is the dotted lines. And when we look into the dura mater, we have two layers of dura mater. There is red color and purple color. So the red color, because dura mater is the tough layer or the thickest layer of the meninges, it actually consists of two layers. The one which lines the bones of the skull is called endosteal. So this is the first one. When you remove the skull, you can see the endosteal layer which attach into the inner surface of the bones of the skull. And the meningeal layer of the dura is the second one. See the red color, which just lining the bones of the skull, while the purple color comes next and is located between the endosteal layer of the dura and the arachnoid layer. So far, so good? Yes? No? Someone say yes? Right, yes?
Yes.
Okay, beautiful.
Yes.
In some region, we've got the meningeal layer that pass or pierce the brain. So it goes deep in the brain, making some processes inside the brain. And then we've got a space here between the endosteal and meningeal layer of the dura. Can you tell me what we call this space here?
Dural venous sinus.
Excellent, dural venous sinus. We will learn their name during the practical workshops. So what we call this as compared to the one on the top and so on. The next slide will show you what we call these appendages or processes. So you can see that we've got one coming on the lateral side that split or it passes between the cerebral hemisphere. So I'll just use this, annotate here for this easier. So as an example for this, let's use different color like this one. So as an example, this one, when it passes, it's split between the cerebral hemisphere, cerebral and cerebellar hemisphere. Okay, I'll just put cell for cerebellum. This one. While there is another one here, part of the meningeal layer that pass just between the right and left cerebral hemisphere. This one has a name which is different from this one. So let's look into their names.
Is that flex cerebri?
Beautiful, thank you. So this is the falx cerebri. So if you look into this one here, so this is the meningeal layer. Now in this section, we have a different vertical section. This is not coronal. This type of the section is called
Sagittal.
sagittal, beautiful. Hence, we split the brain into right and left side. And this is exactly mid-sagittal section, passing it through this one, which is called the falx cerebri. So the falx cerebri, it's the meningeal layer that passes between the right and left. This is the one here, passing between the right and left cerebral hemisphere, okay? And the other one, which is splitting or separate the cerebellum from the cerebrum, is called what?
Tentorium cerebelli.
Fantastic, tentorium cerebelli. Remember, see the name here, cerebri or cerebri, depends how you pronounce it, where this one is cerebelli or cerebelli, okay, related to the cerebellum. So far, so good?
Yeah.
Beautiful. Moving to the next components here about the TMJ or temporomandibular joint. We said that it's a type of synovial joint. It's a modified hinge joint. The articulation here, by the way, the details about this are available to you in the video clips about temporomandibular joints. If you haven't watched them, please go after this lecture and watch them. If you have watched them, you should be navigating easily, quickly in this through these slides. So here the articulation is between the mandibular condyle of the mandible, which is this one here, with two articular surfaces of the skull side. The first one is called mandibular fossa, which is this depression. And the other one is called mandibular eminence, which is this protrusion here. Okay. Yes, we'll try to finish it at 11 o'clock. Even if you leave, that's fine. I'll finish the recording and make it available on the LMS. Don't worry. So because we've got two articular surfaces here, when the mouth is closed, the articulation, I'll just go into the next one to show you when the mouth is closed, the articulation is actually with the mandibular fossa. But when you open the mouth, see the condyle is articulating with the eminence. Hence, we've got two articular surfaces. The other thing that you need to look into, this is the thick articular disc. And this is very important to provide stability and congruence to this surface. We'll also be practicing this during the practical workshop. Hence, because we've got this articular disc, we've got two spaces, which refer to as superior and inferior joint cavities, if you came across these cavities in the relevant video clip. Now, to provide stability for the TMJ, we've got nice set of ligaments, good set of ligaments. On the lateral surface, we've got this ligament. What do we call this one?
The temporomandibular.
Beautiful, temporomandibular ligament. And how about the one opposite on the medial side? What we call this one?
The sphenomandibular.
Fantastic. And posterior, we've got this one which connects this process into the mandible. If you know the name of this process, it's easy for you to figure out its name.
Stylomandibular.
Stylomandibular, beautiful. And if you look here, you should appreciate the its location and the support is provided, like on the lateral, to prevent lateral displacement and so on. Going quickly into the muscles, so we've got four set of muscles of mastication, and this will be covered in more details during the practical workshop of week 2, not week 1. So here we've got temporalis and masseter muscle. Temporalis, you can see this muscle, fan-shaped muscle, and the origin and insertion is available for us here. So the origin is from the temporal fossa and going all the way to be attached into the coronoid process of the mandible, not the mandible condyle, it's the coronoid process. So this is inserted internally on the internal surface, while for the masseter, it should originate from the angle of, from the zygomatic arch and moving all the way downwards to be inserted into the angle and ramus of the mandible. In the workshop, we will be practicing the different movements that are performed by these muscles when they contract. So as an example, when temporalis contract the anterior fibers, it will help to elevate, while the posterior fibers, when it's contracts, will help to retract the mandible. And we'll go through the other muscles as well and try to figure out the movement it's created according to the alignments of the muscle fibers. The other two muscles of mastication, lateral and medial pterygoids. So the lateral pterygoids is the one which is much more horizontal or angled shape, and it's originate from, it's called lateral pterygoid. It's originate from the lateral pterygoid plate, from the lateral surface of lateral pterygoid plate, going all the way to where to be inserted into the ankle, the neck of the mandible, just beneath the head. While the medial pterygoid is also originate from lateral pterygoid plate, but from the medial surface. Hence the name lateral pterygoid and medial pterygoid. Both of them originate from lateral pterygoid plate, but one from the lateral surface, one is from the medial surface. For the medial pterygoid, it goes all the way downwards to be inserted into the medial surface of the angle of the mandible, but on the inner surface. The masseter is from the outer surface, while this one is from the inner surface. That's all from my end. So as I mentioned, we will practice their movement in the upcoming tutorial and practical workshops. You have any question about this?
I have one question, Hajj.
Yes, sure.
Like last year, I just